and welcome back to the SLTV. This video was created from a full-length article on our health website. I will drop the link to the article in the description box. After watching, please make sure you like, share, and subscribe. And please do not forget to come back for more. See you soon.
I want to start today with a number. It's a number I found in the World Health Organization's data, and honestly, I had to read it 3 times to make sure I wasn't, seeing things. 28.5%.
That a heavy number.
It is. As of 2020, Nigeria accounted for 28.5% of all global maternal deaths. I mean, that's nearly a third. A third of all women who die during pregnancy or childbirth worldwide are dying in just one country.
It's staggering. And when you see a number like that, you have to understand you're not looking at a medical problem, looking at infrastructure, culture, policy, economics, all tangled together.
Exactly. And that's our mission for this deep dive. We're not just looking at medical complications. We're taking a multifaceted approach to understand the root causes and, more importantly, the preventive measures. And a spoiler alert, the solution isn't just build more hospitals.
Well, not at all. It's about roads. It's about electricity. It's about what a 5-year-old girl eats for breakfast. It's about whether a generator turns on when you flip the switch.
To really get that, though, we have to move past the percentages for a second. We need to look at the human cost. Our sources introduce us to a specific case study, a woman they call Mrs. M.
And Mrs. M's story is, it's tough to hear, but it is essential. It's the perfect case study for understanding how this entire system can break down.
So let's set the scene. Mrs. M had 2 children already, both by C-section. She gets pregnant with her third. And because of that history, she's terrified. She really, really wants a vaginal delivery this time. The idea of another surgery is just too much for her.
And this is where the first crack appears.
Yeah.
Because of that fear and maybe a lack of trust in the system, she decides not to book any antenatal care. She plans to just wait it out at home.
She wants to minimize her time in the hospital. So labor starts. It gets intense. She's at home. Her husband's at work. She calls him. He rushes home, but he gets stuck in traffic.
The famous traffic. Or just, terrible roads. That's a huge logistical failure right there.
By the time he gets to her, she's already bleeding. They rush to the nearest hospital. Let's call it Hospital 1.
Okay. And they're refused admission. Why? Because there's a power outage and their generator is faulty.
Just stop and think about that. A hospital full of doctors and nurses can't save a life because of a broken generator.
So they scramble to Hospital 2. They get there desperate and they're told, sorry, no doctor is available tonight.
The staffing failure.
By the time they finally get to Hospital 3, it's too late. Mrs. M passed away.
It's a tragedy. But from a public health perspective, her story is this perfect, painful illustration of what we call the 3-delay model. It's a framework from back in 1994, and it frames this whole problem.
Okay, let's unpack that model, because it sounds like she hit every single one of those delays.
Every single one. The first delay is the delay in seeking care. That was Mrs. M decided not to do antenatal care waiting at home. It's driven by fear, culture, cost.
And then the second delay is the delay in reaching the facility.
Exactly. That's the traffic. The bad roads.
And the third delay, the delay in receiving quality care once you finally get there.
That's the broken generator. That's the missing doctor. That's the lack of blood in the bank. And if you want to solve this, you have to attack all 3 delays at the same time. You can't just fix one.
Before we dig into the solutions, I just want to clarify what we mean by maternal mortality. It's not just dying during childbirth, right?
No, it's broader. The definition covers deaths during pregnancy and up to 42 days after the pregnancy ends. That 42-day window is critical.
And to put the scale of the problem in numbers again, the WHO report from 2023 says the ratio is 1,047 deaths per 100,000 live births in Nigeria.
In the global target, the Sustainable Development Goal is 70.
70. And Nigeria is over 1,000.
Yeah, it's drastically off track.
Right.
Medically, the killers are things like high blood pressure, hemorrhage, bleeding sepsis, unsafe abortions.
But knowing the medical cause is just the tip of the iceberg.
Precisely. If a woman bleeds to death because the ambulance never showed up, the cause of death is hemorrhage, but the root cause is the ambulance.
So let's go deep. Let's start with primary prevention. This is the stuff that happens way before a woman even gets pregnant.
This is fixing the foundations. If you wait until a woman is in labor to start caring about her health, you're about 20 years too late.
A huge piece of this is social determinants, specifically girl-child education.
Absolutely. There's a direct, undeniable link. Educated girls become women who have better health-seeking behavior, they understand warning signs, they have more financial independence, and they advocate for themselves.
And speaking of growing up, there was one point in the source material that it blew my mind. It connects nutrition to geometry.
You're talking about the pelvis.
Yes, this was a huge aha moment for me. Can you explain that?
It's a classic example of how poverty echoes through generations. So if a young girl is malnourished, she might get something like rickets. Rickets softens and deforms the bones. If that happens to her pelvis while she's growing up, the pelvis can become misshapen or just too small.
So you fast forward 15, 20 years.
And she gets pregnant. But because of that childhood malnutrition, her pelvis is physically too small for the baby to pass through. That leads to what we call obstructed labor.
That is just wild. So feeding a 5-year-old girl a proper meal today is literally preventing a maternal death in the year 2040.
That's it. Exactly. That's what we mean by a multifaceted approach. It's not just medicine. It's agriculture. It's economics.
Which brings us to money. Financial empowerment.
Well, it's simple, right? If you don't have money, you don't have transport. Women literally bleed to death at home because they can't afford the taxi fare to the hospital.
Wow. And then there are the cultural and legal factors. We have to talk about unsafe abortion.
It's a huge driver. It accounts for about 13% of all maternal deaths. That's a massive slice of the pie.
And because abortion is largely illegal, women are forced to go to untrained people in unsafe environments.
Right. Back alley clinics. So prevention here isn't just about the law. It's about sex education. It's about access to contraceptives. If you prevent the unwanted pregnancy, you prevent the unsafe abortion.
The source also points to corruption.
It's critical. We think of corruption as just, money disappearing. But in healthcare, corruption is lethal. The money meant for that generator in Mrs. M's story, it was probably diverted. Corruption directly creates non-functional clinics.
So that's the foundation. Now let's move to secondary prevention. The woman is pregnant. This is the critical window.
This is where the medical system really needs to step up. And the data shows, it shows huge gaps.
Let's talk about antenatal care, ANC. The stats say only about 63% of women receive it, so nearly 40% are just flying blind.
And we have to ask why. It's not just laziness. A huge factor is what the source calls perception of care.
This is huge. If you go to a clinic and the nurse is rude to you, or the place is dirty, or you feel disrespected, you're not going back.
You're not going back. You'll opt for a traditional birth attendant or a prayer house, even if they aren't equipped to save your life. You're trading medical safety for dignity.
And that leads to the next stat. Only 43% of births happen in health facilities, less than half.
Which is terrifying. If you start to hemorrhage at home or in a worship center, there's very little anyone can do for you. You need a doctor. You need medicine.
And even if the delivery goes well, the danger isn't over. That brings us back to that 42-day rule you mentioned.
Post-delivery care is so neglected. The source says nearly half of all postpartum deaths happen in the first 24 hours.
The first 24 hours.
Yes. But in reality, many hospitals discharge women just a few hours after they give birth.
Baby's out, you look fine, go home.
Exactly. But that's when the bleeding can start. Or when eclampsia, that spike in blood pressure, can happen. The WHO recommends at least 24 hours of monitoring.
Okay, so that brings us to tertiary prevention. This is when things go wrong. This addresses that third delay, actually getting care in an emergency.
Even with the best preparation, complications happen. The issue is how the system responds.
And the referral system seems to be a huge bottleneck, the whole Mrs. M scenario bouncing between hospitals.
It's chaotic. A patient just shows up, unannounced. The hospital says no bed, and they move on. But the source suggests a really practical solution using ICT.
Yeah, I love this one. It's so simple. WhatsApp groups.
It just makes so much sense. Imagine a single WhatsApp group for all the health facilities in an area. Before you send a patient, you just type a message. I have a patient with eclampsia. Do you have a bed and a doctor?
You get confirmation before you put her in the ambulance. That saves hours.
It saves lives. It's cheap, it's easy, and it coordinates the chaos.
Speaking of ambulances, that assumes there even is an ambulance.
Which often there isn't. But the source does mention a new initiative, the National Emergency Services and Ambulance System, or NEMS. They launched a rural program just this year.
Oh, that's brand new.
It is. And the key suggestion here is that these ambulances need GPS. You can't have an ambulance getting lost on dirt roads when a woman is bleeding out.
Right, and once they get to the hospital, you need the actual stuff. Critical infrastructure.
Two big things: blood and ICUs. Bleeding is a top killer. If the blood bank is empty, surgery's useless. You can't rely on asking the family to find donors in an emergency.
That's insane. And ICUs.
COVID-19 exposed this weakness. There's a severe lack of critical care units. You can't treat multi-organ failure from sepsis on a general ward. You need ventilators. You need constant monitoring.
So when you pull it all together, rickets, traffic, generators, WhatsApp groups, it feels overwhelming, but it also feels solvable. It's not a mystery. We know what to do.
We do, and that's the key takeaway. It's not a magic pill. It's synergy.
Synergy.
Yes. It's realizing that better nutrition for girls today prevents obstructed labor tomorrow. Better roads prevent travel delays.
Yeah.
Reliable power prevents hospital failures. Everyone has to move in the same direction.
It's shifting from a purely medical view to a societal view.
Exactly. Maternal mortality is largely preventable. Mrs. M did not have to die. That is the hard truth.
Before we wrap up, there's one last thing the expert in our source touched on. It's a bit of a provocative thought about how we even know what's going on.
Ah, yeah. Data integrity.
Right. We have these big surveys, but
But are we getting the truth? There's a system called the Maternal Death Surveillance and Response, and it suggests we have to count and investigate every single death, not just as a number, but as a story. Why did she die? What went wrong? Was it the road, the doctor, the money?
And that's a scary question for any system to ask itself.
It is. It requires honesty. Because if we underreport deaths to make the numbers look better, we can't learn. We're just flying blind.
So the question for you listening is, are we ready to face what those investigations might reveal?
Please subscribe.
Because until we count every life, we can't hope to save every life.
What's the bottom line?
It's a heavy topic, but an incredibly important one. Thank you for diving deep with us today to understand the real machinery behind these numbers.
Thanks for having me.
We'll catch you on the next deep dive. Stay curious.
Please subscribe. Please subscribe.